Good morning. I'm George Latimer, Westchester County Executive, and I'm here at our Westchester County Health Clinic in White Plains. And I'm joined by our Commissioner of Health, Dr. Charlita Amler, and also Dr. Reena Agarwal, who's our clinic director here at our White Plains facility. And I'm here to do what I have to do and what you should do as well, which is get ready for the winter season that is almost upon us. We're speaking here on Friday, October 20th. We are in the period of time which is the beginning of flu season. And so in a few minutes, I will be administered a flu shot, which hopefully will help protect me against the flu. It does not absolutely guarantee that I won't get the flu, but it likely ensures that I'll have the least impact should I get the flu and will keep me as healthy as possible. And then I will be administered a COVID shot, the new COVID shots that are available. Dr. Amler will talk about that in a second. I have been vaccinated before and on camera before just to make sure I did it over the period of time. And these are proper health provisions that we take in order for proper protection. I am almost at my 70th birthday, and so I am in that target zone of seniors that need to be sure that they protect themselves going into the winter season. And all of us should protect ourselves, but I specifically speak to my fellow senior citizens that if you're hesitant about taking shots, get over that hesitancy because your health is more important than your fear. And I might be have a little trepidation now, but I have confidence in the two doctors that the shots to be administered will be the least impactful as possible. And I intend to have an active day and an active weekend ahead of me, absent the rain. But it's very important to understand that we follow the science. And the science tells us that when you're vaccinated against certain types of diseases, it increases your chance of having a healthy outcome through that period of time. And we know there are different voices out in the land, and we operate on a free expression of your own opinions and your own beliefs. But it's clear to me over my life, from when I was a little boy and I was vaccinated, as many children are, against childhood diseases, that I've lived a reasonably healthy life because at the proper time I've been protected from certain types of diseases. And if I am going to have an active life as county executive, if I'm going to be out in the community meeting you, you pretty much want to know that I'm healthy and not communicating any diseases to you. So with that, I'm going to ask Dr. Charlita Amler to talk a little bit about the process of what we have in the county health department for vaccinations, and then Dr. Agarwal will talk a little bit about our clinic time and hours. Dr. Charlita Amler.
Thank you, sir. Thank you. And so I urge everyone to follow the county executive's example and schedule an annual flu shot for you and your family members who are 6 months of age or older. And believe me, if anyone, understands that there's a lot of vaccine fatigue out there. And, that's just a fact. But we still have to work to protect ourselves and our family and everybody that we care about. We in the public health kind of look to the Southern Hemisphere for clues on how flu season is going to play out every year. This year in Australia, they had a particularly low vaccination rate, especially among children less than 5 years of age, and a correspondingly high rate of hospitalizations. We hope that we don't see that in Westchester. We hope that people will remember to get their flu shot, and as I said, take care of those they care about. So we are urging you to schedule your flu shot for your children and yourself as soon as possible. The vaccine this year does appear to be a good match and should protect you, and especially those who are the most vulnerable in our population against the complications of flu. As the county executive said, there's always a chance that you can go on to get flu. What we don't want is for you to end up with severe illness, hospitalized, or even having, unfortunately, deaths, especially in our pediatric population related to flu. One of the things that is always important to remember that even if you don't think you have symptoms, you can sometimes still be able to spread flu if you're infected to those around you. There are a few reasons why we urge everyone 6 months and older to get their flu shot and to tell them that, sooner is better. It takes about 2 weeks for the flu vaccine to become fully effective. Once it does, it should provide protection throughout the flu season. You don't need to get a second flu shot. This one should last you until May. And as I've said, there's no guarantee with any vaccine that you won't go on to get whatever disease we're vaccinating you against. But what we hope is that it will prevent deaths from the flu. Flu shots are available for a fee for many local pharmacists and medical offices, but if you need to find a vaccine near you, you can always go to www.vaccine.gov, and it should show you where vaccine is available in the closest to where you are. Vaccines are available for the uninsured and underinsured adults and children through the Vaccine for Adults and Vaccine for Children program here at the Health Department. In our clinic, and this is by appointment, you can call 914-995-5800 during weekdays before 4:30 to discuss your eligibility and to schedule an appointment. We always have some of our residents in the county who have difficulty accessing flu shots, and so we will be holding some clinics at our soup kitchens and our homeless shelters. In the U.S., the flu activity is usually highest in December and February, but it can go on into May. So anyone who does get respiratory infections should consider COVID or influenza testing. So if you're having respiratory symptoms, we would encourage you to get tested. There are multiplex tests available that will test for both. To avoid spreading infection to others, we would encourage you, if you're having symptoms, of course, to wear a mask, to cough into your elbow, to wash your hands frequently with soap and water, and stay home for at least 24 hours after your fever goes away. This is just so that you don't spread either COVID or flu to other people. Also, you know the drill. You need to clean surfaces such as doorknobs, handles, and lastly, I would say it's always important to drink plenty of fluids and get plenty of rest when you are facing some kind of viral infection. And if your symptoms get worse, be sure to reach out to your family doctor and have that conversation, and they can advise you what you need to do from there. Thank you.
Next, Dr. Rina Agarwal.
Hi. So I just wanted to say that we are giving, just reinforce what Dr. Amler said, we are giving vaccination here at our county health center in White Plains, and we also have a center in Yonkers. In Yonkers, we have hours on Thursday afternoons, and in White Plains on Fridays. Please give us a call to schedule an appointment. Do you want me to talk about other services? Okay. So we also provide sexual health services at both sites as well, Tuesdays and Wednesdays at White Plains, and Mondays and Fridays in Yonkers, as well as TB, tuberculosis services, on Thursdays in White Plains and Mondays in Yonkers. All of these are by appointment. Please give us a call to schedule those appointments. Thank you.
Thank you. So as I get ready to take the shots for today, let me also mention that just on a personal level, I have received the once-in-a-lifetime pneumonia shot, which protects me from pneumonia. I did that a year ago. I have not yet gotten shots for shingles, which people in my age category are encouraged to do. So that is also part of the vaccination protocol. And I've had the good fortune of not contracting any of these diseases. I hope this will get me through the next period of time. This, though, is the most embarrassing day of the year for me as a county executive, because this is when you find out that your county executive does not look like Arnold Schwarzenegger when he takes his shirt off. So I have tried to lose some weight. I haven't lost enough, but it really doesn't matter how you look. What matters is, are you healthy? And that's really what this is about today. So, ladies, I will prepare to take my shots.
If I could add one
Please
last
do.
thing that we forgot to mention, and that is the fact that there is a new vaccine out this year for RSV for infants, pregnant women, and elderly. Older. I'm one of those elderly people. I'm over 60. So for anyone over 60 who has underlying medical conditions. So in the over 60 population, it's not an automatic that you should get this vaccine. You really should have a conversation with your physician about the new RSV vaccine if you're over 60, and they can help you decide if it's appropriate for you. But especially infants, pregnant women, we would encourage them to also talk to their doctors and think about getting this new RSV vaccine. Thank you.
Thank you. Okay, I guess I have to do what I have to do.
Okay, do I need the vaccine? Oh, here it comes. Okay.
One down, one to go.
One down, one to go. No screaming, no hollering. Good job, sir. I wish I was as brave.
Thank you.
Thank you.
Thank you very much. We appreciate having the professional services here in our county health department. If you have financial need, please take advantage of the county's ability to help you and your family stay safe. Have a wonderful weekend, and hopefully I'll see you out there fully healthy and happy to interact with you in the days to come. I'm George Latimer. Thanks for watching.